With this module, as we all know that sexual and reproductive healthcare module is an integral part of our Part 3 curriculum. Because the Part 3 curriculum, there is going to be a must station from this module as well. And sometimes what happens is that this module, gynecology module, and the some of the stations of even the postmenopausal age group, some of the time they also bring as a station. Of course, it is not going to be in terms of the reproductive, but of course some of the stations can overlap in fertility module as well, because it will come under the reproductive health area. And like if we talk about the major essence of this module, so the major essence of this module is going to be, number one, communication. So your communication should be very, the choice of words should be very good. And at all times, you should be using, the very suitable phrases, suitable sentences, which are very much important for this particular, the module, or you can say, the any of the station, because some of the stations are going to be very sensitive, isn't it? So, anything can be related to sexually shared infection. It can be HIV, it can be chlamydia, it can be trichomonas, it can be, the bacterial vaginosis. There is a very, the famous station on bacterial vaginosis as well. Then there can be, the young girl, the teenager who's coming for emergency contraception, or maybe termination of pregnancy, or maybe it can be the same-sex couples as well. There can be, the transgender these days. Okay, so the any module can come, and like the any of the syndrome, Turner syndrome, MRCOG syndrome, AIS, androgen insensitivity syndrome. Then there can be a couple of the questions which can be related to the the what you can say that direct their sexual health as well. So of course some of the questions are going to be very sensitive, and the very much important as well. So at all times, as an exam candidate, what we need to do is that we have to keep our the expressions very the, you can say, the neutral. Okay, at all times you don't have to show any kind of the emotion. Your expression should be in fact very straight. Okay, so I mean it shouldn't be like, it shouldn't be like astonishing. Okay, and it shouldn't be like frightening as well. Like, I mean, if you are going to the explain anything, so I mean the choice of words is going to be very important in this particular module, like the infertility, early pregnancy. So of course the major essence of this module is going to be communication, communication with colleague, communication with the patient, communication with relative. And the, of course, communication will be based on what? Information gathering. So information gathering is going to be based on applied clinical knowledge. So almost patient safety. Yesterday, somebody asked me how we are going to assess that, what is going to be the patient safety. So of course, patient safety is going to be a prime, the domain to be tested in almost all, the stations there is. So, nonetheless, some of the, the things are going to be very much important for a particular station. Okay. For example, if you are, the breaking the news of sexually shared infections, of course, what is going to be the safety? Safety is going to be the contact tracing. If you are not doing contact tracing, it means that you are breaching, the somewhat, the safety of the other individuals who are involved with this particular patient. Okay, so the things are going to be, the very, the vast, interconnected, challenging as well. So at all times, always think of that, what if I do this station by this angle? So which is going to be the important, the perspective for this particular station. Okay, so if we talk about this the particular station, so of course communication and safety, applied clinical knowledge will go hands in hands and side by side as well. Okay, I think the in last week as well, I have announced that we are having on site the circuit course, and this is going to be held in Islamabad 29th and 30th October. So anyone who is interested, please the get in touch with me or with mid exam expert team, because we do have limited seats. And of course by the end of the when we are going for any the course, so it it doesn't look the nice if somebody is approaching and asking for seat, because that the limited seats are there. And of course I'll be there to conduct the course along with my the team and other mentors as well. On the other hand, I am I have very limited slots now. I'm almost fully booked, but I still can accommodate some of the the candidates who can approach me for one-to-one mock the test as well. For the people who are going for February exam, So I am taking, the February registrations too. So anyone who is interested can contact me, can contact, the MedExam expert team as well. Okay. Because, by the end, when I'm fully booked, so I feel really bad, if I have to say no, because I don't take so many candidates. I just take limited candidates, and my focus is to train them. My focus is to, give them good guidance with the best of my knowledge. Okay. So if anybody who is interested, so please get in touch either directly with me or MedExam expert team. Okay. So on-site course, mocks, and the February one-to-one course as well. All right. So, with regard to this sexual and the reproductive healthcare module, so the domains are same. Like I have told you, information gathering. Of course, information gathering is going to be there. Information gathering is based on what your the applied clinical knowledge. If you don't know anything about the particular the disease or infection or anything, so how you are going to extract the knowledge? Okay. So in terms of information gathering, so you have to bring your communication along. So in terms of information gathering, what RCOG needs is a candidate is able to take a detailed sexual history sensitively, initiate timely and appropriate investigations, and use these to formulate a the thought out management pathway, including contact tracing. Like I have told you, contact tracing is an essence. Or if you have to give any advice regarding contraception, so this is also going to be very much important. Communication, yes, sensitive area you have to touch, okay, and the trainee must be able to show an ability to communicate, bearing in mind the sensitivities such as the patient itself, beliefs, societal perception, and any labels mean if she is the same sex couple or same sex, if he or she is in the same sex relationship, sexual diversity, age of maturity, diagnosis, treatment, and contact tracing as well. Plus, of course, the implication for the fertility. Communication with colleagues in terms of that, when you have to stop in your treatment, when you have to involve your consultant, when you have to defer to the gum clinic as well. All plus minus family planning services too. Okay, so this is very much important. Of course, you have to refer, but at this level, what your exam is, that at least you know what A, B, C, D, E, F, G is basically. Okay, at least you have to tell initial thing that okay, they can offer you this, they can offer you this, they can offer you this, or you can be offered this. At least give her some idea that okay, in that particular clinic or in that the service, this is going to be the proposed management plan for you. Applied clinical knowledge, of course, is going to be according to the the topic. So please revise your stuff. Okay, the candidates who are aiming for November exam, so we don't have time. Okay, so you just guys October, and then from 7th of November, I guess, yeah, 7th of November, yes, 7th of November, the part 3 is starting. So I think you don't have enough time. Okay, so plus minus 7 days. So please start revising your stuff. Okay, applied clinical knowledge is as equally as important as your communication. Okay, never think that this exam is only communication. Never think that this exam is only applied clinical knowledge. Okay, so everything goes hands in hands. Everything needs the proper the attention in terms of domains. Okay, so in terms of applied clinical knowledge, a candidate should be able to demonstrate the use of critical evidence to manage the patients, including correct application of laws. For example, if it is termination of pregnancy, so everybody should be thorough that what are the the laws of termination of the pregnancy, and up to how many weeks we can go the safely, and after how many weeks it is not going to be termed as, what is going to be this, what is social abortion, and everything. In terms of the rape and sexual assault, so yes, this should be on your tips as well. Rape, sexual assault is also the very important topic, and recently we have had the couple of stations from that too, isn't it? Child exploitation, there are talks available. Okay, sexual assault talk, child exploitation talk. So please guys, do revise your stuff. Okay, so don't just try to mug up the ready-made the templates available here and there. Don't run after all those templates. Trust me, by the end of that your preparation, all these things are going to be the nothing in front of your preparation. Okay, so please do try to revise your own stuff. Do try to the what you can say, the rehearse. Okay, do try to rehearse as much as possible. Doesn't matter, I have the my whole drive full of the material. So, I mean, what am I going to do by the end of my preparation if I have never touched that material as well? Or if I have touched all those material, the relatively, but I have not practiced. Okay, so please practice, rehearse. This is the high time when you guys have to be on your toes, when you guys have to be rehearsing. And the candidates who are part of the multiple courses here and there, so please narrow down your activities. Okay, please focus on yourself, please focus on what you have to do, what you have extracted from here and there, and then apply it for yourself. In the end, this is your exam. In the end, nobody is going to help you but you yourself. Okay, so patient safety, like I've told you earlier, that the patient safety is going to be almost, the prime domain for almost every station there is. So maybe you don't have to, the pass all domains, but the what I have seen so far is that patient safety still is going to be, that domain in which you have to pass as an overseas, or even the candidate who are aiming to work at NHS. So of course, patient safety should be there. Okay, so do try to find out in every station that, okay, if I'm rehearsing this station, if you are the studying with your study buddy, so you can always ask each other, okay, hey, look, let's try to find out that what is going to be the patient safety in this particular station. So write it down, note it down in your mind. Okay, so next time you don't have to forget that. All right, so I think this the overview of this module is pretty clear. Is there any question, please?
Dr.
Okay.
Zaib,
Yes.
Dr. Zaib, this infertility clinic for agiospermia patient. Do you think that we can ask that? Do you have anybody with you for this breaking bad news?
What's your answer?
I think because I'm confused now. Some are they told that we can ask, no problem, but some are they told that no, we cannot say that. So that's why I'm confused.
I'm with the second thought. Okay, I would never ask, or for example, if I'm a male person, so I would never let anybody know that I am infertile or I'm having this problem.
Right. Okay.
See,
okay,
there can be the multiple school of thoughts, but always think that what is going to be the appropriate the situation or appropriate thing to address. Okay, and by the way, this is not even that important, that if you will not call anybody, so your marks is going to be cut. No, your exam is going to be the azoospermia rather. Okay, so if nobody is addressing the azoospermia types and the treatment of azoospermia, and rather focusing on would you like somebody to call to call in, would you like somebody to be with you, to support you for what? See, everybody has the different school of thoughts, but if I am in the exam and if this station is coming as an azoospermia, I would never ask for that, would you like somebody to be with you? Or yes, if you really want to involve somebody, you can call your nurse in, isn't it? You can call your support nurse in. So I mean, that is going to be the okay if you really want to call somebody, but rather asking a friend, a family member, or I think it is pretty unreasonable. Okay.
So it will be same as female also if breaking bad news,
Yes,
that infertility
yes.
case. Yeah. Thank you very
Of
much.
course.
Okay.
Of course.
Thank you.
All right. So who wants to present today's session? Last time I remember it was Hira. Yes.
I can present if nobody want to do.
No, let's see. Okay, if nobody comes, then I will ask you. Okay. Okay. Yes. Guys, please speed up. We don't have hours. We just have 1 hour to finish the scenario as well. So who wants to present?
If nobody, I can also try. Thank you.
Can I try, Dr. Zaib?
Yes, who is this?
Usha.
Usha. Yes. Last time you asked, I remember. Yeah. Okay. Yes, come on. Okay. Yes, Usha. Okay.
Yes.
Sure. Let me show you. And don't be shy, okay? This is just practice, the session. Nobody is going to judge, okay? Remember, I think I have told you guys earlier as well. When I was preparing, I did my first session in exact, I think 17 or 18 minutes. Even when I finished my, the preparation, I was just about to finish in around, the 11 or 12 minutes. But yes, our aim should be, less than that. But don't be shy, don't be upset. Okay, so Usha, your time starts now, sweetheart.
Okay, thank you.
Mhm. Okay, ready?
Okay. Hello,
Yes.
I'm Usha, one of the doctor in Gynae clinic today. May I confirm your name and age, please?
Yes, I'm Emily Cooper and I'm 32 years.
How may I call you?
Yeah, Emily is fine, doctor.
Okay. So, Emily, I believe you are here for contraception. Is that right?
Yes, doctor, actually, I have visited GP for about 2 weeks ago. But, he was kind of, the skeptical regarding, the options for me. So he
Mhm.
referred me to the hospital. So that's why I'm here.
Mhm. And any other particular concern for this meeting today?
No, that's it.
Mhm. Okay. So, is it okay if I ask you a few questions to know more about your health?
Yes,
And then
doctor.
we can discuss.
Yes, yes.
Okay. Okay. So, have you ever used contraception any type of before?
No, doctor, but after my the delivery of the kids, my husband is using condoms, but I'm not very much comfortable with that.
Mm.
Sometimes I feel that it may fail and I may get
Yeah,
pregnant, so I really don't
yeah,
want that.
yeah, you are right. Yeah,
Yes.
it can failure. So, and what kind of do you have in your mind?
I don't know. I was just thinking of pills. So
Mhm.
when I discussed this with my GP, so he said that I don't think that the pills are
Ah,
suitable for you. So that's why
okay,
I really want to discuss.
okay, no problem. So we will offer inform you all about the contraception, and in the
Yes.
end, whatever you choose, we will, if they are safe, we will respect all
Yeah,
your
sure,
wishes.
sure, sure, doctor.
So, may I know, have you, yeah, you said you had one delivery before, no?
Two deliveries,
On
doctor. I have two
two,
kids.
two kids, okay.
Yes.
Any other apart from that, any miscarriage or anything?
No,
Mhm.
no.
Okay. And are you, when was your last menstruation period?
It was for about 2 weeks ago, doctor.
2 weeks ago,
Yeah.
okay. And are you up to date with your cervical smear?
Yes, I am.
Okay, okay. And may I know any other medical problem which you follow? Any diabetes, high blood pressure,
Yes,
any
yes, doctor.
asthma?
Yes, I am having diabetes. and I am taking the tablet glucophage as well for that, and yes, I do have hypertension as well.
Okay. And what medication are you on?
Yes, I think it is something called atenolol maybe. Yes, I am on.
Retinol. Okay.
Yes.
Okay. I will note it down. And any other family history of like any cancer or any clot in lung, leg and
Mm,
lungs?
not like, I mean, the clot or
Hmm.
the cancer, but my parents, my mother and father, they both are diabetic as well.
Yeah. Okay. Okay. They are on treatment as
Ye-
well. Okay.
Yes, yes.
Okay. And may I know your height to weight ratio?
Yes, doctor. It is 26.
26. Okay.
Sorry,
And
yeah, it is 26. No, 26. I was earlier, so it is almost 32 now.
32. Okay. Okay. And have you done any work? Do you have any concern about your height to weight ratio?
No, I have always been a big girl, doctor. So not
Okay. Okay.
not as such concern.
Okay. So, and any sorry to ask you some personal question, if you don't mind.
Mhm.
Have you ever diagnosed or treated for sexually shared infection?
No, doctor. No.
Okay. Okay. And any any vaginal discharge, any pain in tummy, anything like that?
No, doctor.
Um,
No.
okay. And may I know your period, how they are?
Yeah, they are quite regular. For the initial 2 days, sometimes, I do bleed heavy, but afterwards, it gets normal. And apart from that, there is no issue.
No issue. Okay.
Yes.
So, coming to your concern, your options for ultrasound, sorry, contraception, we do have a couple of options,
Mhm.
like pills. These are hormonal pills, but as you are having a diabetes and also your height to weight ratio is a higher side, so this is this option, may not safe for you
Mm,
because
Why,
mhm,
doctor?
because you are having a diabetes
Mm-hmm.
and your height to weight ratio is higher side and you are having a your BP is higher. I,
Mm-hmm.
you are taking medicine.
Okay.
So yeah. So other options like the three type, yeah, pills are the safest option is the copper, the coil. The two types of device, copper coil, which is impregnated copper, and the other one is the marina coil, yeah, which
Mhm.
is a hormonal coil. One more thing I forgot to ask, any future fertility plan?
Well, doctor, just because of this diabetes and hypertension, and even in my last pregnancy, it was quite complicated as well. So,
Oh, sorry
yeah,
to,
my
oh,
doctor
sorry
put
to
me
hear
on
that.
some the injections for
Mhm.
the prevention for the clots, because she said that I can be the high risk for the clots. So at that time, so that's why I don't want to become the pregnant in near
Uh,
future. So that's why I
oh,
was
okay.
seeking for any
Oh,
good contraception.
sorry to
Yeah.
hear that about your complication. So yeah, so you have got one risk, called clot. So these pills, oral pills are not safe because the estrogen containing pill, they will make you, high risk of any clot as well.
Mhm.
So the safest option for you, this the copper or marina coil, and this will be fit inside your wound. And the good thing is failure rate is very less compared to other. And also you can, because the copper coil is for 10 year and this marina coil is for 5 year. So whenever you want, you can get rid of up to that. So would you like me to explain you more about these coils?
Doctor, one more question. So is it going to affect my diabetes and hypertension as well?
This copper coil and this merino coil, they are not going to affect they because local absorption is very less for this hormonal coil. So these two are the safest one.
Okay. So,
And
I mean, okay, fine. So, is it going to cause any kind of infection for me as well? Because I
yeah,
remember one of my friend, she had that copper coil and she had, the repeated infections afterwards.
uh, repeated infection with the coils. Well, evidence doesn't show the infection with the during actually they will it will be done by expert. They will take the swab before if you have an infection, they will take the swab. So make sure and they send it if and they will if they doubt anything, then we will give you prophylaxis antibiotic. And
Mm-hmm.
however, putting some very small risk like infection and sometime, very small risks, it can make a hole in your wound, but it will be done by expert. So these complication will be, reduced. And however, the one thing, if the failure rate is very less, less than 1 in 100, and
Mm-hmm.
if it is fails, then there is a small risk. Then there is a risk of no pregnancy if you miss the period, and then you need to come to hospital because there is a small risk of pregnancy can be in the tube. We call it outside the womb. We call it
My God.
ectopic
So it looks
pregnancy.
scary, doctor. Then you
It's,
said that,
but this will, as I said, this will done by expert. We are
Mhm.
here to give you all the information. The other one is the Marina coil. It is for impregnated the hormone progesterone, and this will be stay in 5 years. And also
Mhm.
success rate is very good. Very failure rate is 1 in 1,000. So and as you know, this is it will be done by expert and with all the precautions, but a very small risk,
Any other option apart from this?
yeah,
This looks scary
other
to
option
me.
is the implant, which is the injection progesterone, and it will be for 3 years. It will be under the implant in your arm. Yeah,
Mm-hmm.
you can
Okay.
you can have this one, and other one is injection, which is also progesterone. Yeah, every 3 months you have to come to
So, I
hospital
mean,
to
is it safe for me to have that?
these are okay. Actually, the safest one is the marina and copper one.
Mm-hmm.
Hmm.
Okay,
So
fine. So when can I come, doctor, for this? Because I really want to, start
yeah,
with this
you have got,
method.
yeah, okay. So the best time is the next one, fifth day, at least fifth day of your period. You can come.
Mhm.
It will be fitted. Or yeah.
Okay, fine.
So any question till now? So what?
Um, I will think about, doctor, all the
Yeah. So
options.
okay,
So which
whatever
one do
we.
you suggest, that Mirena or copper coil? Which one is going
Yeah,
to be the
it's
better
what
option?
we can't suggest you. We are here to give you information, and you are the one who decide. And whatever we discuss, we document it and share with your GP. Yeah, and I'm giving you this information leaflet, and you can read more about it. And whatever you decide, we will, it's-
Okay, okay, fine, fine. Okay, thank you, doctor.
thank you for your time.
Mhm. Okay, so how was it, Usha?
We did not revise this contraception always. Always is scary for me. I always confuse with it.
Okay,
Um,
so do you think that in terms of history, your history was complete?
Uh, Actually, what I missed,
Yes.
I checked BMI, whatever I thought, whatever relevant, I
Hmm.
checked.
Hmm.
Oh, I did not ask support
Hmm.
and domestic violence. Do I need to
Hmm.
ask you?
Hmm.
Uh,
Hmm.
and
Hmm.
anything, it's not coming in my mind. What is relevant?
Allergy status.
Oh, allergy.
Everybody is so in love with this allergy. But in this particular station where a
So
person can
copper
have copper
allergy. Yes,
allergy,
copper
no,
allergy. Oh,
nobody is giving me the answer.
oh, oh, copper
Okay.
allergy.
Yes,
Uh-huh.
yes, copper allergy. You are offering her, the copper coil as a, the
Mm.
suitable option. So at least inquire about, the allergy to the
Oh,
copper or any other, the metal allergy or any medication. Okay. So this is
yeah.
important in terms of
Oh,
that, when patient told you herself that, I have had something, I know the clots treatment given in the pregnancy. So I think you should have inquired afterwards that, have you had any kind of, the investigations afterwards, and what was the
oh,
reason for putting you on those injections? This is important, isn't it?
oh,
What
okay.
if she is having any underlying thrombophilia?
From
Okay.
Philia,
Nonetheless,
okay.
of course, we're not going to give her, the combined oral contraceptive pills, because any hormones, in fact, we can't give.
Yeah,
Of course, the
yeah,
better option is going to be the LAC. Out of the LAC, the better option is going to be the copper coil and Mirena local system.
yeah,
Yeah. And but
yeah.
sweetheart, always remember, always try to give options first, and then come to, she is coming for combined oral contraceptive pills. First tell her that, what they are going to do is this can be a good option if, you haven't had, all these kind of, the problems with you. Okay.
Okay.
So the
Mm,
second time you can say that, apart from this, we do have, the long acting reversible contraception methods as well, in which we do have, the injections, we do have implants, we do have, the local intrauterine system, and the copper coil as well. Coils with the
mm,
copper, and the other coil with the hormones as well.
mm.
So, are you interested in learning about all these methods? Yes, doctor. Anything. She will tell you anything, because this is your exam. Okay. So
Mm.
don't just fix your mind that, okay, because you are here for the pills, so this is not a suitable option. So okay, just let
Um,
me talk about the copper coil. Okay. So
um,
always
yeah.
remember, once you will finish your history. So I think rest of the history was okay. Your
Mm.
introduction was okay. Your agenda was okay. And your history was kind of good. But when you were asking about, the obstetrical history, in terms of that, how many kids do you have, and, any other pregnancy, any other miscarriage or something. So can you please tell me, have you had any kind of, the problem while you were
Mm.
pregnant, or during delivery or afterwards? So she will give you, another piece of
Mm.
information that, yes, I was on, the heparin, okay, injections. So
Mm.
then it will come into your mind, okay, another risk factor. So yes,
Mm.
the pills are not going to be the suitable options. In
Yeah.
fact, for every hormone, you have to think, the double while you are going to
Mm.
give her. So of course, we are just left with copper coil, or we are just left with, the Mirena. But still, we have to think of copper coil more. So now you will bring her to the point where you are
Mm.
going to give her enough information to, the narrow down your options. Okay,
Yeah.
Usha? So you will narrow
Mm.
down your option. You will tell her that, okay, thank you so much, Emily, for giving me this information. So you said that, you were thinking of, the oral contraceptive pills. Am I right? Have you ever tried any of the contraceptive methods before? No. And can you please tell me that, when was your last, the delivery, and how was it? Yeah, doctor, it was for about 4 years ago, and my both kids are cesarean. Now you still have to be more, be careful
Mm.
about the every option there is. Okay.
Yeah.
So how many risk factors are there? Two cesarean section, obesity, diabetes, hypertension, family history of diabetes, along with, the personal history of clots. So
Yeah.
hormones, no
It's
hormones.
not.
Okay.
Mm.
So now we are
Mm.
going to tell her, why we can't give her hormones. Now you have to justify. Now this is your exam. Okay.
Yes.
Nobody is going to ask you to narrate the complete guideline, but now your exam will start in next 4 to 5 minutes. Okay, so examiner would really like to focus on this thing, that how this the candidate is the performing station now, because your history is almost good. Okay, apart from allergy status, apart from the thrombophilia screening in terms of clots. So I think apart from this, your history is almost good. So then you have to thorough. Okay, so you can say that yes, the pills are the a suitable option for certain women who don't have the any kind of history, because what happens is that the pills are having hormones, the estrogen and progesterone, that makes the the blood little bit thick, and the tendency of that thickness is going to the is going to the impose any kind of development of the clots. Since you already had the clot, and I can see that your weight is on a little bit higher side, so I don't think that this is going to be a suitable option for you, because at present we don't even know that what was the reason of the development of clot for you in the pregnancy. So first of all, we need to ascertain that. Okay, so I might need to involve my consultant. I might need to refer you with the, after having the discussion with consultant, that you might need to refer you to the blood disease specialist as well. All right. So because we need to find out that why have you had that the clot formation in the pregnancy. Okay. And apart from that, in terms of contraception, so yes, we do have the couple of other options as well. So in terms of the long acting reversible contraception, by saying reversible means that whenever you would like to discontinue them, you can the pregnant anytime soon after that. Okay, so we do have implants, we do have injections, we do have coils as well, and the coils can be the copper coil can be the hormonal coil Mirena as well. Okay, but I think again the I'm afraid, you can say that I'm afraid the hormones are not going to be again the suitable option for you. So I think the copper coil can be the suitable option for you. See, you are narrowing down your options yourself. Okay,
Yeah.
so if even if you don't have any knowledge about as far as my the contraception studies the is concerned, so I think it's better not to give any kind of hormone to the the history of DVT, personal, in fact the personal history of DVT. So it's better not to give, because estrogen and progesterone both can cause. Okay, of course estrogen has the more the chances, because third degree progestogen, that is the disogestrel, gastrodine, and the all da things. So I think these are more, the formation of clots, DVT. So you can narrow down your options. So you can say that, so we do have, the copper coil as well, since I can see that you don't have any allergy. So, you can be a suitable candidate for that. So what can happen is that, you will be called after, the once you are the having periods, and it's better that we insert in the first 5 days, and because for this one shouldn't be pregnant, so we will be ascertain that you are not pregnant, so we can insert it at that time. Okay, and would you like me to tell you that what are going to be its risk and what are going to be the benefits? So benefit is going to be that you can keep it for longer period of time. Okay, say from 5 to 10 years you can keep it. Okay, and anytime when you want to discontinue the method, you can come again and we can remove it. All right, and with this, there can be small the risk involved, and the good part is that it is effective in the contraception as preventing the pregnancy in about the 99 out of 100 women. Okay, so it is going to be the very much effective. And apart from that, the chances of infection can be there, because you already are having diabetes, so you have to be very much watchful for the any kind of the you can say that the any discharge, if there is any down below, any itching, any discoloration of the any of the vaginal discharge, so you will immediately report. Okay, because then you will have to be vigilant for that. Apart from that, there can be the small risk at the time of insertion. There can be injury to the neck of the womb. There can be in very rare and severe cases, there can be the perforation when the coil can go through and through from the womb to the abdomen or tummy. Okay, but that is very serious and very rare complication. Ideally it is the kind of a very safe the method. And after that, what you have to do is that after every heavy, so you said that you had the heavy flow in the first 2 days. So after having the periods, you just have to the feel the string. Okay, feel the thread which is going to be in your vagina. Sometimes what can happen is that with the heavy flow it can get expelled, and after having sex you have to feel it, and you have to feel it like quite on and off. Okay, so this is just this is the the precaution afterwards. And I've told you that when you have to remove it, when you wish to become pregnant again, so we can remove it anytime. So again you will have to come to while you are beyond your periods, so you will come again, and we can remove it. Okay, and removal is quite easy, so don't worry about it. Okay, Emily, am I clear so far? Mhm. So would you like to give it a thought of having this copper coil? Yes, doctor. Okay, so I will discuss it with my husband. Okay, yeah, sure. So I will give you, the patient information leaflet on this long-acting reversible contraception at NHS. You can read even more about it. Okay. Plus, I will involve my consultant. Okay, I will discuss your case with him because we might need to involve in terms of your clots. So we might need to refer you to any other specialist as well. Okay, Emily. Okay, fine. So meanwhile, Emily, while you choose it, so I will encourage to use the condoms, because condoms are very much important. It can protect you from development of any sexual shared infection. Okay. Okay, fine. Okay, Usha.
Yes, thank you so much.
Okay, so this
Yes.
is how you can go. And yes, in terms of if you are going for coil insertion, you have to do examination as well. And examination is also everyone's favorite part to be
Yeah,
discussed. Okay.
I thought she just come for discussion. So
Take
I mean,
focus history, initiate an
yeah.
investigation, offer contraceptive advices. For example, if she agrees for, the coil, and she says that, yes, I do want, to be inserted now. So you can say, okay, for this, I may need to examine you in the presence of chaperone. Okay, because I have to check that you are free of any infection, you are not having any problem, and I have to do your tummy examination, I have to do speculum examination, I have to do bimanual examination to see, look and feel the womb and neck of the womb as well. Okay.
Okay.
So and she is hypertensive as well. So yes, blood pressure.
Yeah.
Blood
Yeah.
pressure. That is going to be
Yeah.
important, isn't it?
Yeah.
Yes.
Okay. Thank you.
Okay. So now what you have learned, Usha, let's revise. How
Yeah,
you are going to.
I have learned how to narrow down your
Yes, very
options.
good.
Yes, and
Very good.
I miss the allergy. Usually, when I practice or when I usually don't do, but today I miss this allergy. So it's really. And I
No
actually
problem.
I
No
ask,
problem.
yeah, I asked a clot in family. I think I was about to ask any personal and family history, but I just missed that word personal. I thought I can do together. Usually but
No problem. No problem.
so
But
yeah,
see, this
so
is how we
asking,
learn,
yeah,
right?
separate,
Hmm.
yeah.
This is how we learn that we
Mm.
have to narrow down our options when we do have a lot to speak. So you will narrow down your options according to the patient needs, according to the patient, the understanding. So of course then only you can speak, otherwise you will be scattered. Otherwise, I
Yes.
mean, it's a kind of ocean. Okay, like somebody is asking, implanon can be given, we can give options of progesterone as well. You can give all options, but at least you should know that which one is going to be safe. Okay,
Mm.
now this is your exam. Now this is you who should learn that whether we
Yeah.
can we give progesterone to any woman having DVT, can we give progesterone? Okay, so this is how you have to go
Mm.
for that.
Mm.
Investigations, the vasectomy, you can simply tell that, okay, Emily, we do have the couple of contraception options. One are the reversible options, and one are the permanent options. In terms of permanent, see, you are not going to talk about here the tubal ligation, but you can just simply touch. You can simply say that, okay, in terms of the permanent procedures, we do have the tubal ligation for males and tubal ligation for female as well. Okay, for the female we call it as tubal sterilization, for the male we call it as vasectomy. If at all none of the options are going to be suitable for you, so then we may need to sit with your husband, and we may need to discuss about the vasectomy as well. If at all you think that the station is going towards that direction. Okay, but the altogether vasectomy, tubal sterilization, this should be in the end when you see that, okay, you have got time and you think that you can discuss.
Okay. So we have to touch these two names as well.
You
sister.
can
Yeah.
you can touch, okay?
Mhm.
When you are,
Mhm.
because of course, you know, when we are counseling about contraceptions are long acting reversible contraception.
Mhm.
These are reversible. Then we don't have we have irreversible or permanent methods, okay? So you
Mhm.
can touch.
Okay. Okay. Thank you.
Okay,
Mm.
okay. All right. What investigations? So investigations in terms of that, you know, because she's diabetic, hypertensive, and we might need to do any swab test, right? We might need to send her for thrombophilia screening, plus, you know, the diabetes, whether it is under control or no, blood pressure. We have to, you
Yeah.
know, be very watchful in this.
Yeah. I just because I want to. When I ask history, so he said, yeah, diabetes. I'm taking diabetes and blood pressure. Yeah, under control. So
Mhm.
so still I need to do further this
No, no,
thing.
no, 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 no.
Okay.
Investigations.
Yeah,
Investigations.
investigation.
Hmm.
Yeah, that's why I'm asking. Still, I
Mm-hmm.
need to send blood sugar.
You can go for, okay, just to be on
Okay.
safe side. If she is telling
Mm-hmm.
you, so you need to be sure that, you know, at the time of insertion, her blood sugar is not 200, 300 plus. So at least you
Mm-hmm.
should be safe.
Okay, thank you.
And on the other hand, swabs before IUCD
So,
insertion, you know, if
mm,
there is any vaginal discharge, you have to take swab, you have to give chlamydia
mm,
prophylaxis. Okay, if there is, you know, the swabs are not available, you can give chlamydia prophylaxis, azithromycin 1 gram. Okay, and
mm-hmm.
this particular station, you have to send her for thrombophilia screen. Okay, I think this is
Yeah,
very much
yes.
important.
Yeah. Okay.
Hmm.
Mm-hmm.
This is not high BMI case. Okay, if you want to address high BMI, you will be lost. You can simply, if you
Mm-hmm.
really want to touch high BMI, so you can simply, Usha asked that, you know,
Mm-hmm.
have you ever tried to, you know, think about your weight? So she told that I have always been a big girl. Okay. So, you know, nonetheless, you know, you can, if you really want to touch BMI, so I think BMI itself is a very, you know, the separate station, because BMI needs a lot of, you know, the input. BMI needs, you know, if you will, you know, the simply go about high BMI, I think, but still, you know, it's better not to. It's better not to. Don't bring so many difficulties into one station. Okay. If the station is quite, you know, the clear, so just, you know, talk about that station only. Okay. Kamal?
Mm-hmm.
Okay.
Thank you
Any
so
other
much,
question?
Dr. Dev. Thank you.
Okay. Okay, Usha. Very good.
Thank you.
Any other question, guys?
Hello, Assalamu alaikum, Dr. Zaib. Uh,
Walaikum salam.
I'm Kamal. Not related to this station, one question in my mind, how with the history we can differentiate the vaginismus and transverse vaginal septum? Because both the basic complaint is difficulty in intercourse.
So in vaginismus, there is going to be problem in the end, you know, the initiating and entrance at the time of penetration. Even in the, you know, the vaginismus, you know, the sometimes the patient can give, you know, the any kind of history of stress or something. In septum, there is not going to be penetration at all. Okay, in vaginismus, patient may be, you know, the stress, patient may be, you know, the somewhat kind of, you know, the upset as well. And in vaginismus, there is not going to be, you know, the single attempt, or you can say, you know, the difficult attempt of penetration. But in the septum, there is going to be, you know, the penetration, but maybe it will not go, you know, the farther than, you know, the where the septum is, because septums are three, you know, the lower, middle, and up. So, you know, nobody knows that, you know, the which type of septum is this. Okay. Hmm.
Dr. Zaib, excuse me.
Mm-hmm. Mm-hmm.
Can we can ask only this sexual health or other question we can ask?
Other question means?
Like if patient is coming for, that prolapse, second stage of prolapse, and
Mm-hmm.
same time she has stress urinary incontinence also. So at the time, maybe she's taking that pelvic floor muscle exercise,
Mm-hmm.
but I can advise her that lifestyle modification and to continue her pelvic floor muscle exercise
Mm-hmm.
and
Mm-hmm.
to use pressari also.
Mm-hmm.
But for this surgical management, so it is, if it is that means if it is posterior colpoperidorrhaphy, that means posterior prolapse, posterior wall prolapse, I can advise her that posterior repair. Yeah, that means posterior colpoperidorrhaphy. But for stress urinary incontinence, so do you think that separately we can tell about the colposuspension, or it is enough that only posterior repair and the pessary and pelvic floor muscle exercise? What do you think?
I'm sorry, I didn't get your question. Means a person is having stress incontinence, person is having UV prolapse, person is having posterior vaginal wall prolapse as well. Am I right?
No, only posterior vaginal wall prolapse, stage 2.
Okay, stage 2. So stage 2 is for only the pessary. Stage 1 and stage 2 is only pessary. We
But
don't
she
go for
had
colpoperidorrhaphy. If
No,
it is stress urinary incontinence, you can offer the urodynamic studies, and then you can ascertain, and then only in that scenario, then treatment is going to be for stress urinary incontinence, not for the prolapse. Because according to the guideline, stage 1 and stage 2 is just the pessary.
yeah, pessary, but she has this problem and she wants surgery, but she has stress urinary incontinence also. If we explain to her surgical option, we know that the pessary she can use, but for surgical option, what we can explain to her, because she has two problems. One is that posterior prolapse, stage 2, and the stress urinary incontinence.
So that's what I told you. If it is stage 2, pessary. If it is stress incontinence, go for urodynamic studies, and then you can offer her, the burst colposuspension or tape procedure. Okay. Then it is according to your station. What is your station? Is your station about the prolapse, or is your station is about the stress incontinence?
This
Then
is
you have to
both,
find out.
both together.
So you will tell her about pessary, and then you can offer her, the specialist input. You will offer her urodynamic studies, and then you can offer, the both, the tape procedures as well as the burst colposuspension.
Okay, thank you.
I will not advise to go for the posterior colpoperidorrhaphy in stage 2. It's against guidelines. Okay. And even in the posterior wall prolapse, you have to be very careful because bowel is involved. Okay. So before offering, any the treatment option, you have to be very careful.
Yeah. Okay. Thank you.
Okay. Okay, that's great. Any other question? No question? Okay, that's great.
Dr.
Ma'am, one
Zaib?
question I had.
Yes.
Yes.
So, ma'am, it is the urogynecology module. Can I ask?
Okay.
So, ma'am, what cases do we report to BSUG?
BSUG, what do you think you have to report to? Do you even report to British Society of Urogynecology? Or do you refer, if there is BSUG is British Society of Urogynecology. You have to
Yes, ma'am.
report mesh erosions to MHRA only. Okay?
Yes.
According to the
Yes.
guideline, you have to report mesh erosions to MHRA. That's it.
And so,
BSUG has leaflets. BSUG has BSUG is basically the independent the body. Okay, so you don't have to report anything.
So
As
do
far
we have
as
to send the
I know.
data to them for the audit purpose? Like,
I don't know. Maybe, I don't know. I don't know.
Okay,
I have never read it in any of the guidelines. If it is written, I may the recheck. Okay.
okay, ma'am.
I think Dr. Jeff, data they know, but they will not, for public. That's the thing.
I don't
That's
know. I'm sorry.
what I
I don't go
understand.
into so much of details. I just try to keep myself very focused onto the station and this and that. Even this is not your exam. Okay, nobody is going to ask you. You haven't sent this patient to
Yeah.
BSUG, so you are failed. No, come on. Okay?
I think just they report it. They know the number.
Reporting is MHRA. Okay.
Yeah,
Mesh
MHRA.
erosion is important, and mesh erosion, according to the guideline, we have to report to MHRA. As far as I know. Mm. And BSUG is independent, the body.
Yes.
Okay.
Dr. Zaib, you are right. This is written in the guideline, what you told. Yeah.
Yes.
Yeah. Thank you.
Okay. Because I just follow guidelines and nothing. I don't look here and there. So whenever I asked, my candidates as well, I asked them, okay, please give me, any kind of reference. Where is it written? Okay. So maybe, we may not be well versed of the system, but these are the things which are, the commonly stated in all guidelines and talk articles. So I think it's better to stay focused rather than, looking for so many fancy stuff. Okay. So at this level, nobody is, looking for urogynecologist or infertility specialist in exam. Okay. Everybody wants a safe, good, the very, the good candidate who is just about to start his or her NHS career. Okay, as ST3, ST1, ST2, whatever. All right. Okay, that's very good, guys. So I will see you inshallah next week with the another module. So keep studying and the stay focused. Don't go here and there. Okay, just try to practice as much as possible. Okay, practice is a must for this exam. So rehearse, rehearse, and rehearse. All right.
Thank
Okay.
you.
Bye bye.
Thank you
I
for
will see you
giving
in the next.
opportunity.
Okay, okay. That's very great. Okay. See you guys next week, inshallah. Bye bye.